Welcome to Giving Breaths in Infant CPR. In this video, we will discuss the steps of how to give breaths to infants. Like children, many cases of cardiac arrest in infants are primarily due to respiratory problems. Giving breaths and administering chest compressions are important for infants receiving CPR. A good breath will cause the chest to rise. To give breaths, first open the infant's airway by putting one hand on their forehead and placing your fingers on the bony part of the chin. Then, gently tilt their head back to a neutral position while lifting the chin. Be careful not to tilt the head too far back, as this can block the airway. Be sure to press on the bony part of the chin and not the soft part under the chin, as pressing the soft part may also block the airway. To give a breath, hold the airway open, take a deep breath, and seal your mouth around the infant's mouth and nose. Blow for 1 second and watch the chest rise. Very little volume or force is required to inflate an infant's lungs. Blowing too much or too hard will damage the infant's lungs. Only a gentle exhale for a tiny puff of air is required for an infant. Repeat for a second breath. If your mouth is too small to cover both the infant's mouth and nose, give breaths through their nose while holding their mouth closed. If the chest does not rise after the first breath, let the head go back to normal position, then reopen the airway by tilting the head and lifting the chin. Try to get a breath in while watching for chest rise. Do not interrupt compressions for any more than 10 seconds while giving breaths. This concludes our lesson on giving breaths in infant CPR. Next, we'll review mask use in infants.